If you're getting ready for the NCLEX, you already know that pediatric infectious diseases can be, well, a huge challenge. So today, we're going to do a strategic preview of how you can master these really critical topics. Okay, let's get right into it. This right here is the absolute heart of what the NCLEX is testing. It is not a memory game. It is a clinical judgment exam. They want to know, can you spot a problem early on, and do you know what to do about it safely? And really, the stakes could not be any higher. In the real world, if you miss the early signs of something like measles or whooping cough, it can lead to just devastating complications for a child. And on the exam, that exact same missed clue can mean the difference between passing and failing. It all comes down to your clinical reasoning. So in this little preview, we're going to pull back the curtain and show you exactly how the Exam Coaches platform organizes all this complex information. Seriously, it's not about memorizing lists of facts. It's about building a mental framework you can actually apply to any scenario they throw at you.
So let's start with the problem itself. Why do so many nursing students feel totally overwhelmed by these conditions? Well, it's because on the surface, a lot of them look frustratingly similar. You see a fever and a rash, and you think, okay, now what?
Does any of this sound familiar? You get so bogged down trying to memorize the exact pattern of every single rash that you miss the subtle, dangerous signs of a complication, like meningitis, and you're not sure what to do first. Do I isolate them? Get vitals? Call a provider? It's these priority decisions that make all the difference. And that brings us right back to the main point. The exam rewards the nurse who sees the risk and acts safely. It's all about connecting the dots, from what you see in your assessment directly to your priority nursing actions. So let's see what that actually looks like in practice. We're going to start with two classics that are so easy to get confused. Rubeola, which is regular measles, and rubella, or German measles. They both show up with a fever and a rash, but what you need to prioritize is critically different. Okay, just picture this question popping up on your screen. You see fever and rash. Now, you might be tempted to start digging for more assessment data, but the NCLEX is testing your ability to put safety above everything else. So, what is the very first thing you need to do to keep everyone safe? Yep, that's it. Before you do literally anything else, you have to prevent transmission. Your immediate priority is to get that child into the right type of isolation. That single action protects all the other patients, the staff, and any visitors. It's always, always a top priority for communicable diseases. Now, here's how you need to frame your thinking. Instead of a long list of facts, you focus on what makes them different. For rubella, measles, you're looking for those classic 3 C's. That's coryza, cough, and conjunctivitis, plus those telltale Koplik spots in the mouth. The priority, get them into airborne precautions immediately. For rubella, the rash is a bit different, but the huge, flashing red light is the risk to pregnant women. Your absolute top priority is to isolate that child from anyone who might be pregnant. All right, let's move on to our next pair and see how this framework keeps building. With mumps and chickenpox, after you've handled that initial isolation, your focus has to shift to watching like a hawk for some very specific and very serious complications. Okay, here's another scenario. The kid is already diagnosed with chickenpox. The initial interventions are all in place, but now their condition is changing. That new high fever and the lethargy, those are your key signals. What are they telling you, and what do you have to do right now? And just like that, your priority has to pivot to assessing for complications. That sudden change in condition is a classic sign that something else is going on. Often, it's a secondary bacterial infection from scratching those lesions, or it could even be a more severe neurological issue. Your job is to catch it early. And this really shows you the why behind that priority. With mumps, you're on high alert for orchitis in boys and for signs of meningitis, like a severe headache. With chickenpox, your main goals are keeping up those airborne precautions and doing everything you can to stop them from scratching, because those open vesicles are a gateway for some really dangerous secondary infections. Okay, now let's shift gears to a condition where the priority is immediate and life-threatening. This takes us right back to the absolute fundamentals of nursing care. Let's talk about pertussis. This is one of the most frightening things you can see in pediatrics, an infant who can't breathe. Those horrible coughing fits, that unmistakable whoop sound, and especially the cyanosis. This is an airway emergency. There is only one correct first move. ABCs: airway, breathing, circulation. Your absolute #1 non-negotiable priority is to maintain a patent airway and get them oxygen. Everything else can wait. This is the definition of a life-threatening situation. So you see, every single key intervention flows from that one main priority. You get them into airborne precautions, you give them humidified oxygen, and you have suction at the bedside ready to go. You're constantly monitoring their respiratory status, and you're even creating a calm, quiet environment to keep from triggering those awful coughing spells. Every single action supports the airway.
Okay, so we've looked at measles, mumps, and pertussis. On the surface, they seem pretty different, but there's a consistent thought process underneath it all. Let's tie these examples together to show you the unified system behind the exam coach's approach.
This is the framework. It's a simple, repeatable three-step principle. First, you recognize the key signs, the things that make one disease stand out from another. Second, you prioritize your action based on the biggest immediate risk. Is it transmission? Is it a complication? Is it the airway? And third, you act to prevent it from spreading any further. This system just works every single time. And this is so important to get. Anyone can hand you a textbook or a list of symptoms to memorize. That's not what helps you pass the NCLEX, and it's not what makes you a safe, effective nurse.
At Exam Coaches, we train clinical judgment. We train you to see the subtle signs of a complication before it gets out of hand. We train you to know, instantly, what the priority intervention is. We train the NCLEX level thinking that is absolutely essential for pediatric safety.
I want you to remember this. When you're staring at 4 options on the exam, and they all look kind of correct, ask yourself this one question. Which action keeps my patient the safest right now? That is almost always the key to the high-scoring answer.
So, what you saw here today, that was just a little glimpse into the way we structure content to build your clinical confidence. The complete, in-depth framework for truly mastering pediatric infectious diseases, well, that's waiting for you inside the Exam Coaches platform.